I should get started here. Thank you, everybody who's joining us today during the South Dakota snow apocalypse, or so it seems on weather television. This is Thea Ryan. I'm Thea, and you'll also see Stacy, who are from the Ollie office here in Sioux Falls, where we're working from our homes because our buildings are closed. So welcome, everyone. I see we have people from near and far. Thank you so much for joining us. Today, we are going to talk about a really important topic, and I'm going to let Darla, who is our guest speaker, tell exactly what that topic is, because I haven't memorized the name of your office. It's a really long name. So thank you, everyone, for joining us. And Darla, welcome.
Welcome, everybody. Thank you. It's so nice to be back here with Ollie. And I was here last year, but I did an Ollie short on love poetry. So a little bit different topic, but today I'm going to talk about my work that I do at the Center for the Prevention of Child Maltreatment. And it is a long name. It took me quite a while even just to get the acronym right, but we are often known as CPCM. And then I'm going to give a brief overview of that and then talk a little bit more specifically about a project that I'm leading for the center and for the state partners. Really, it's a collaborative grant that benefits all South Dakota children. So let me share my screen here. Let's see. Okay, I think because of I'm not sure if I start the slideshow, if it will stay on the same screen or not. So I'm going to just leave it like this for now. But the grant that I'm working under is from HRSA, which is a Health Resources Services Administration. It's a federal grant, and it's the Prenatal to 3 Early Childhood Comprehensive Systems Grant. And so I'm going to tell you a little bit more about that, but first I want to tell you about the Center for the Prevention of Child Maltreatment. We are housed at USD. We're in the School of Health Sciences, and like Thea said, since about June, I think we've been there. Previously, we were down by the Children's Hospital, right in the middle of Sioux Falls, but we're up north, which benefits me because I live in Brookings, so don't mind getting on the interstate and driving down to work at CPCM. We were formed in 2017. It came out of a legislative task force that you might have heard about before. It's called the Jolene's Law Task Force, and it was a summer study and then extended, and it was looking at what can we do in South Dakota to prevent and to respond appropriately to child sexual abuse. And so a lot of what we do at the center focuses on sexual abuse, sexual victimization of those under 18. We run the SANE grant program, the Sexual Assault Nurse Examiner program, which is not just youth specific, but it trains nurses how to respond and collect the kits that they might need to do prosecution. We have some court improvement projects where we look at how are courts intervening when families and children are engaged with them or find themselves in the judicial system. We work with professionals across the state, and honestly, a lot of our work is in partnership with other units or other departments within the School of Health Sciences or at USD, or also with our state partners like Department of Health, Department of Social Services, Unified Judicial Systems, etc. So you might, if you live in Sioux Falls, you might have seen before there's a Community Response to Child Abuse Conference in October, and that's something that we also do in our office is coordinate that. So we focus on how can we know, prevent, and respond. So what do we know about evidence-based best practices? How are we responding and intervening in ways that don't increase harm to victims? And then how are we working together to prevent harms from happening to children specifically? our work has, well, it started on the child sexual abuse. We really focus on preventing of adverse childhood experiences. And so you might have heard of this research about ACEs. There's 10 of them. It's quite an older, well, it's not that old, it's in the 90s, but it was a study that identified some things that could happen in childhood or before the age of 18. And then they correlated it later in life to increased risk for health problems. And you know, this is, if you've heard about it, if you haven't heard about it, Google it, ACEs. There's just a lot of research. There were originally 10 things, and now there's additional research that's added to that. Things like neighborhood violence, for example, can be considered now an adverse childhood experience. And then there's a whole new body of research that talks about positive childhood experiences. Like, what are those conditions and things that we can add to children's lives that are going to provide some protection against the most severe harms when adverse things do happen. So what you're looking at right now is a CDC strategies for preventing adverse childhood experiences. And I like to show this because it really helps explain, I think, why sometimes CPCM will be engaged in conversations about mental health or about you know, family-friendly workforce policies, et cetera. But the strategies on the left are those that agencies, individuals, communities can take, or the approaches that they can take to preventing adverse childhood experiences. And again, we want to prevent these because we know that that can increase you know, health risks, but it also there can also lead to correlated increases in things like missing work days, kind of interrupted work productivity. And for our work at CPCM, we know that there's a research that shows there's a link between adverse childhood experiences and then an increased risk for being a victim of crime later in life. So, you know, so sometimes when people say, well, why is CPCM doing a grant about early childhood? You know, it's because our work is framed around, or we use this framework from the CDC to align all of our work product with. And the grant that I'm going to talk to you about really focuses on that third strategy, or ensuring a strong start for all children. So I wish I created this. This is a pretty nifty infographic. It's from Build Initiative. And this is just to show that when you think about what is a comprehensive system, or what are all the things that could come into play and could work together to form this perfect galaxy of support for children, and not only children, because we know they're born into families, but also for their families that would help ensure that strong start. And so Build Initiative is one of the organizations. There's several in the nation and across the world. Now, if you follow Harry and Meghan, or not Harry and Meghan, excuse me, the other royals, you'll see the Duchess or no, the Queen, I don't know. I'm not up on my royal history, but anyway, even in England, this is a strong initiative now of the royal family, is what can we do to support the strong development for all children. And so it really goes a lot into it when you think about that comprehensive system. It's not just one thing, but it's all of these working together. So the grant, like I said, is from HRSA. It's called the Early Comprehensive Systems Prenatal to 3. And it really seeks to how can we get these systems working better together, knowing what we know about brain development and how critical those first 3 years are. What can we do to help increase the health system's involvement in early childhood? And how can we help reduce barriers to coordination? And so sometimes, you know, health systems or health organizations have their rules about how to protect medically sensitive information. Education systems have FERPA and how can you protect and the information. And, one of them is coming more from a medical perspective. The other system might be coming more from an educational and a social support perspective. So how can we get all of these systems working together better, especially that prenatal to 3, because we know that the brain is like really, growing and coming online at that age. It's a critical period in the neurodevelopment of the child. And we know from the ACE study that the brain architecture and how that brain is formed and supported during those earliest years and those earliest experiences really can set the stage for later success and strong, healthy development and well-being. So, HRSA requires, we're one of 20 awardees. And again, we're holding this grant at CPCM, but we have some critical partners and some support before we submitted the grant from the state partners. We're one of 20 awardees right now. The others are all state agencies. I believe Minnesota has the ECCS funding right now. It's been around, this program since HRSA has been around since 2003, but South Dakota has not had it before. I think there was one other state and us that both got it this first round of funding. And so some states are much farther along in this work than South Dakota is technically, although what we're finding is that our South Dakota agencies and organizations are doing a lot of this work to align systems. It's just that we have not been doing that under the ECCS funding or in a formal sense with support from the federal agencies. So like all other 20 awardees or the other 19 awardees, there are some required partners. We did form a cross-sector advisory council, and we actually had to have letters of support from these offices before we applied for the grant. So because it involves the health system and the education system, the two, you'll see like the Title V MCH block grant program. This supports so many programs in the state for infants and families. Things like the screening that we do for all children, well child visits, our community health offices and the services that they provide. The McVie program is the home visiting program. So you may have been hearing in the news about a lot about home visiting. The model that the state has been using is called nurse-family partnerships. And it's an evidence-based model for supporting mothers, families from prenatal up until the child is age 2. And again, that program and home visiting in general is also linked back to not only better outcomes for children, but the lens that we take at CPCM is that it's also linked to child welfare, child maltreatment prevention. So Title V and our McVie program are all heavily involved in this work. And then as well as Department of Social Services. And if you haven't ever taken a look at their website and all the programs that they offer to support children and families, I encourage you to do so, because the Department of Social Services does our things like Medicaid and, SNAP. They run when people need assistance for childcare services, getting childcare, and they maybe have some income barriers to that. That's all run through the Department of Social Services, as well as Department of Behavioral Health and all the services that they provide, and CPS, which is your Child Protective Systems. And then the grant requires that we have some health providers. So 2 of our large major medical systems wrote in support of this grant and are participating in the work. And then the Office of Early Childhood Services, which is within the Department of Education and runs the state's Birth to 3 program, as well as some other early interventions to make sure that we're really capturing and supporting those children who might need additional, early interventions so that when they get to school age, they are ready to succeed. As part of this work, we have, like I said, we formed the advisory committee. One of the things that I'm really proud of is that we've also meaningfully engaged with our families, and we have a family leadership advisory board as well. And then there's some crossover between those two groups. And we've used that family leadership group. It's made up of about 15 family members across the state. They're really helping to lead and guide and bring that parent's perspective to the work so that we can all be confident that what we're doing is actually what families say they need and want. And then we focused, the first year, we focused a lot on our system asset and gap analysis. So taking a very high level look and seeing what do we have, what is working well together, what is coordinating well together. And then we're working on our early childhood strategic plan, which some states have in place already. And they might even have like an office that would coordinate and manage that plan and help ensure that it's being implemented across all the agencies. But since we don't yet have that plan adopted at the state level, this grant is helping to create that and then to just raise awareness overall to how the importance of these coordinated systems are for children and families. These are just some of our guiding principles. I won't, for the sake of time, I won't go through all of them, but I think one of the things we're working on is that collective impact. And I think people know this. We all know it's important to collaborate, but what's difficult is when you're working on, you know, your programs and your budgets, it's sometimes difficult to come up out of that and be able to look, you know, across the aisle or look at the organization next door and really get out of the day-to-day work and think about how can we do this together better so that together we can have this collective impact, and so that it's not your work or my work, but that it's co-owned and co-implemented. The one on the lower left, this adaptive leadership, is also something that we're working hard to understand. So I sometimes say this is we're flying the airplane while we're building it. And so collective impact, when you're going into these large scale public health problems or things that you're going to tackle that are complex, sometimes, and it's collaborative especially, sometimes you don't know where you're going to end up when you start. And so just working to raise everybody's comfort level with figuring it out and adapting, trying some things. If it doesn't work, you know, course correcting, etc. And then that shared responsibility and building upon all. So because of those state plans are already in place, like all of those I showed before have their individual plans, we're trying to crosswalk and build upon what's already been identified as needs and priorities and successes, so that we're not, you know, reinventing the wheel. And again, this plan is not intended to be owned by CPCM, but it's really how can we build that shared vision of what it would look like to really have a coordinated, comprehensive system that supports our youngest South Dakotans. So this is, you know, this just shows you right now, like South Dakota does not have that shared comprehensive plan. We don't have a single public office or a governance structure that's responsible for coordinating all these programs and services they're doing wonderful things, and they often do collaborate and coordinate within programs or across agencies. But if you know, I don't want to give the impression that coordination and collaboration is not happening, because it really truly is, but we just don't have that sort of all encompassing umbrella plan that everybody is working towards. So what this slide shows is just how complicated it can be, because the families are often working with the same programs, or with the, you know, like the same family or the same child might be interacting with several of these agencies. So for example, if a child is born, you know, and has a newborn hearing screening, for example, over here in the Department of Health, They might then get referred to be seen by an audiologist. And we know in South Dakota that on average, when you want to see a pediatric specialist, on average, families have to travel 100 miles farther in South Dakota than they do for the national average for the distance it is to see a specialist. So we know families might have to travel a long way, or there might be some barriers to them accessing that services, including like financial support. So they might need some support over here, from the Department of Social Services. That's going to increase economic security, help people get to where they need. And then if they are referred to, if they're seen by the audiologist, then they're referred to birth to 3, perhaps for some early intervention. Then they're going to go over to the Department of Education and, have a different system to navigate. So again, just when you think about children, like individual children and families that are accessing services and supports, just a visual to see how complex that can be for them and for the agencies that are providing that support. So again, this ECCS, or this Early Childhood Comprehensive Systems grant, is a lot of planning and a lot of working together to create that shared vision, and to have everybody take a step back and say, okay, what do we have that we already are doing really well? What is working really well, and how can we work collectively to build upon that to create even a stronger comprehensive system? Again, so that we can support that nurturing environment that's going to help protect the brain development, and that's going to really create that strong foundation and that strong insured start that will help them create their brighter futures. So that is a super high level overview of a very 5-year grant. I say sometimes it's a 5-year grant for a 30-year solution, but we are at the place now where we are, we have our plan draft. We need to get everybody signed off on it, and then we'll be making that available. And again, that idea is that we want to have that vision where all South Dakota children are ensured that strong start through the access for their parenting, education, health, any family support services that they might need within a coordinated system of care and delivery. So questions, thoughts? Here's my, and Thea, you'll probably share this afterwards too if you want. You can share my contact information, but I'm just, that's a whole lot of information at once, but I'd just be curious to hear any thoughts or questions.
One thing I'm not sure I understood is, did your team, are they hands-on with children, or you're administering the program?
Yeah, that's a really good idea. Good question, Thea. So one thing I didn't say when I was talking about CPCM is that no, we do not do direct services with children. We're more like helping come alongside to ensure alignment or to help systems work together better. And that goes for all the work that we do at CPCM. We also, if you go to our website, you'll see some legislation, and we will, when our policymakers have questions or want advice, sometimes they'll reach out to us individually, but we'll also kind of look at what's coming, and if it's like sexual abuse, sometimes our director will even go and speak or testify during session. But no, we do not do direct services.
I see. Yeah. That I wasn't sure about.
Yeah.
I've liked the part about informing the parents too, like the 2-generation support that you mentioned. I think that's a really good way to look at it, because you see programs like Head Start or something like that that really focuses on the child, at least my knowledge of it, and this may have changed, but to educate the parents too is so important.
Yeah, yeah, and I would say that a lot of programs do work with providing support and education to parents, and that
Good.
idea of family engagement. I mean, so I'm the ECCS lead for the state, but then we've also contracted with South Dakota Family Engagement Center, which is on the other side of the state, and they support the ECCS family lead, Darby Hunt, and she does a tremendous job of working with the family members who are part of the project. But yeah, that idea of how can you bring families alongside and how can you really learn from families what's working, what's not working, what supports do they need to be able to navigate systems better.
Anybody have any questions? Feel free to unmute or put them in chat. Looks like you covered a lot there.
I know it's a lot, and but it's exciting. And again, the grant itself, when the ECCS funding started, 2003, sometimes there's different versions of the grant, you know, every 5 years or every 6 years, they'll come out with a different iteration of it. And some of them were more site specific or place-based specific. So the only time that, you know, in our, like I said, within our borders of South Dakota that we've had ECCS funding was an earlier version was awarded to the Great Plains Tribal Leaders Health Board. And it was called the ECCS Impact Grant. And they used that to launch at Sisseton, Wahpeton, Oyate. They have something called the First 1,000 Days Initiative. And they were looking at how can these systems within a single community work better together. And then there was another one, you know, that was ECCS Learning. So the whole grant was focused on just learning opportunities and shared learning. And then this one is like sort of that higher level when you look at your whole state, not just the systems within a single community. How can you reduce barriers to coordination between the systems at the state level? So
Thank you.
Yeah, it's fun work. It's can be potentially very impactful work. So that's what we're aiming
Very
for.
much so. And I'm so glad that we had you here today, because a lot of times, even though this group of people, Ollie, we're a pretty informed group. We stay on top of, you know, a lot of things that have to do, especially with our own states. And, you know, there's some things we just don't know about because it doesn't ever hit our radar unless it hits it. So thank you for making that happen for us. We just want to be more informed citizens, and I think we are now.
Yeah,
This was a great.
Yeah, and I would really invite you, if you go to our website, again, we're part of USD, so you can find our website by looking, you know, that route through the University of South Dakota's website.
Yep.
Or you can go to sdcpcm.com. Our annual report is in there. More description, you know, about ECCS. There's some recordings of some panel discussions we had earlier last year, but you can also like sign up for free trainings and other free events. We have a webinar once a month that might be of interest to people. So just invite you to, learn more. That was just a tiny little bit about just one of our programs. So
awesome. Darla, thank you for your time. I really appreciate it. Thank you, everyone, for attending today. I know it's a cold and snowy day, and everybody probably is thinking more about being outside and shoveling, right? Just even if we're not working or not indoors or outdoors, just want to remind you, we'll be back here with more Ollie Shorts through the end of February. We have tomorrow Vermilion Rocks. And that's a really fun program. It also happens in Sioux Falls and Brookings. So it just happens that our speaker is from Vermilion. But Betsy will be talking about some artwork that she does and some really cool art rock trading that they do. It's a fun program. Thank you, Darla. And we will see you all hopefully tomorrow. Thanks, everybody.
Bye-bye.
Thanks so much, Darla.
You're welcome. Thanks for having me.
All right. Take care.